So if you are faced with a situation where an animal has collapsed and you are the first responder or the first person on scene, then you need to go through a series of checks. In order to know whether it's appropriate to carry out CPR, the first thing you must check is whether the animal is conscious. Now, levels of consciousness can vary, but ultimately you need to be aware if the animal is conscious, then it will be breathing for itself and it will have a heartbeat. If it is not conscious, then there's a potential chance that it may not be breathing or not have a heartbeat. So you need to, first of all, determine the level of consciousness. Now, to be able to rouse the animal, you can clap your hands, which can be done at a safe distance. So you can clap your hands, try and shout the animal's name, Casper, Casper, or you can try and gently give stimulus to be able to get the animal to respond. Some people advise you to pinch the paw. This is hypersensitive for the animal, so if they are conscious, they will retract their paw because it would be relatively painful for them. With all those checks having been carried out and the animal still not responding, you can assume that the animal is unconscious. So you now need to check whether it's breathing or not. Now, again, there are several ways in which this can be done. First of all, from a safe distance, you can sit back and just see if you can see the chest rising. Alternatively, you can listen to see if you can hear any breaths going in or out. And you can also use the back of your hand to see if you can feel any breaths. A mobile phone or a mirror is also useful because you can see if there's any condensation appearing. If there is no evidence of the animal breathing, you then need to see if there's an obstruction, because that would be the reason why it's not breathing. So as long as you believe it is safe to do so, you can open the animal's mouth and look down to the back of the mouth. You may notice something there, some reason why it can't breathe. And if you do see an obstruction, it's recommended that you obviously try and remove that safely. And you can use your fingers or a wooden spoon handle or a stick to try and get the obstruction out. If you can't see an obvious reason why it's not breathing, you can then give breaths to the animal. Now, these initial breaths you give to see if the animal's able to respond. So you give 3 to 5 breaths. Now, we're going to make sure that the animal's in a good position to receive those breaths. So leave the animal on the side that it has collapsed on. You don't need to turn the animal over, but you can stretch the legs out. By doing this, you're opening up the chest cavity even more, just to allow more air to get into their lungs. You can also extend the neck and bring the chin up, making sure that there's nothing in the airway. So you can make sure that the airway is as patent and as open as possible. You can bring the tongue forward. You don't pull the tongue out because we need to close the mouth, but if you brought the tongue forward again, it's making sure that it's not in the way and it's allowing good airflow down into the airway. So, with all those checks done, we're now going to give 3 to 5 initial breaths. You do this by holding the animal's mouth shut so that we can administer mouth to nose. The air that I give is going to go into the nostrils and down into the lungs. When I do this, I'm also going to check and feel to see if the chest is rising, because if I can't feel the chest rising, my air is not getting into the lungs, and you need to investigate why that is. So we're going to give 3 to 5 breaths. Now, these initial breaths might be enough for the animal to respond, particularly if there's something in their lungs like water. This might be enough for them to trigger a coughing up of the water. And from that point on, they might start to regain consciousness and you therefore deal with the symptoms presented. However, if the animal doesn't respond to those initial breaths, you need to assume there's something more serious going on. And your next check is to see if there is any indication of the heart beating. So we're going to try and find the pulse. We're going to use the femoral artery to do this, which is found in the top of the groin, tucked into there. So I'm going to use 2 fingers pointing upwards, and I'm going to try and see if I can detect any form of pulse. Finding a pulse can be difficult, particularly if it's noisy or if there's distractions around. So always make sure that you tell people to be quiet or to simply move away. And we have our our helper in the room. It's actually worth noting at this point as well that if you are in a park or a public place, it's probably best that you ask people to remove other animals away from the scene. Another dog can respond quite aggressively, in fact, to an animal that is unconscious, particularly when they see that you are administering treatment to that animal. So again, for your safety, always get other dogs and other animals away. But obviously we're not, this particular intruder is not posing a threat to me at the moment. Okay, with regards to the pulse, I can't feel a pulse, so I have to assume that the heart is not beating. And at this point, I'm now going to consider giving CPR. Now, to be able to do this, I need to know roughly where the heart is. Now, a dog's or a cat's anatomy is the same as ours in most senses, and the heart sits in the chest cavity. It doesn't matter what side the animal is laying on, but what we can do is, using the forelimb here, we can pull this leg up slightly, and where the elbow touches the chest is a rough indication of where the heart is. So you can do that if you're not sure. So I'm going to place the palm of my hand here, the other one on top, and interlock my fingers. I'm then going to bring my shoulders forward. This is because it allows more force, more pressure to go through. I'm now going to administer 15 compressions. I'm now going to give 2 breaths. And 15 compressions. And 2 breaths. At this point, I'm going to see if I can detect a pulse. Again, going to the femoral artery. Now, if I can detect a pulse, it would suggest that the heart is making an effort to beat for itself, and therefore my chest compressions have been effective, and I will stop chest compressions. I will still focus on the breathing, because it doesn't mean that the animal is breathing, but if there's any sign that the heart is trying to beat for itself, you do not continue with chest compressions. If you can't detect a pulse, you go back into the pattern of 15 compressions to 2 breaths. And at this stage, I'll check for a pulse again. And you keep this going. It's worth noting that giving CPR can be physically exhausting. If there is anyone that is available to help you so you can delegate, maybe if you did the compressions and somebody else did the breaths, then that would be really helpful, because if you become tired, you become less effective. So try and delegate and try and use the people around you. If at any point you notice that the animal is responding, either by detecting a pulse, or it's starting to breathe for itself, or it's starting to regain consciousness, you stop what you're doing and you deal with the symptoms that are presented by the animal in that moment. Always be aware that if the animal does regain consciousness, it is likely to be disorientated, potentially fearful, maybe even aggressive. So you need to make sure that you are ready to protect yourself as well. Always be ready to restrain the animal. Out of fear and disorientation, they may want to run away, and you certainly don't want them doing that immediately after this. So you need to make sure that you are ready to restrain them. Don't allow the animal to get up straight away. They should, even though they are regaining consciousness, encourage them to remain laying down, talk to them calmly, reassure them, and then you need to work out how you're going to get them to a vet. Even though your CPR has been effective and the animal is now breathing and it's conscious, you need to still get them to a vet, because the vet needs to determine whether they're still at risk of going into cardiac arrest again, or the reasons why they went into cardiac arrest in the first place. So that's really important. One other point on your safety is, whenever you are conducting CPR on an animal, always do it from behind. Never be in front of the animal, because when this animal regains consciousness, it's going to be heading in that direction. So by being behind them, it gives you a few extra seconds to get yourself to safety and to make sure that you are in a safer environment. Okay, so that's CPR. It is relevant to any mammalian species. So this could be applied to dogs, cats, rabbits, ferrets, rodents, and I have known people to give CPR to rodents, even the larger mammals such as cows and horses. The concept and the technique is the same. Never practice CPR on a live animal, either using a resusci dog like this, or even just a soft toy, and just getting used to the positioning of yourself and that pattern of 15 compressions to 2 breaths. Practice will make you more confident, and it will make you more efficient at giving CPR.